Have you ever been told to do a pelvic scan or a transvaginal scan and you wondered what the difference is? Are they the same thing? And which one gives a better picture? Let us break it down. Hello, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound and women's health education. And in today's video, we will talk about pelvic ultrasound scan versus transvaginal scan. First of all, pelvic ultrasound is the broad term for an ultrasound examination of the pelvic organs. It can be performed in two ways. The first one is transabdominal pelvic scan. This is where the probe is placed on the lower abdomen. It is popularly called pelvic scan. The second one is transvaginal ultrasound, also called TVS. This is where a specialized ultrasound probe is gently inserted into the vagina. So technically, a transvaginal scan is also a type of pelvic ultrasound. The major difference is how the organs are visualized and how close the probe is to them and the location of the probe. For transabdominal pelvic scan, this is what everybody simply calls a pelvic scan. The sonographer places the ultrasound probe on your lower abdomen. For this examination, you will usually be asked to have a comfortably full bladder. Why? This is because the full bladder acts as an acoustic window or as a mirror to help the sonographer visualize the uterus and other pelvic structures. A transabdominal pelvic scan can assess the uterus, the endometrium, sometimes the ovaries, the adnexa, the bladder, pelvic masses, fibroids, large ovarian cysts, and pregnancy, especially as the pregnancy becomes more advanced. One major advantage is that it is non-invasive. There is no probe insertion. It can also be useful for women who cannot or do not want to have a transvaginal scan. Another advantage is that it gives a wider overview of the pelvis and can particularly be useful when assessing larger masses or a more advanced pregnancy. However, there is a limitation. Because the probe is farther away from the pelvic organs, the images may not be as detailed, especially when you are trying to assess small structures. Now, what about a transvaginal ultrasound? With a transvaginal ultrasound, a specialized design probe is gently inserted into the vagina. Because this probe is much closer to the uterus, the ovaries, and other pelvic structures, it can provide higher resolution, that is higher image quality, and more detailed images. TVS is particularly useful for assessing the endometrium, including its thickness and appearance, the ultrasound and the myometrium, small fibroids, the ovaries, small ovarian cysts, for antral follicular counts, the adnexa, early pregnancy, the embryo and the cardiac activity, ectopic pregnancy, pelvic pain or abnormal bleeding, and most importantly, follicular tracking. And because this probe is closer to the pelvic organs, like I said, a full bladder is generally not required for TVS. In fact, you will be asked to empty your bladder before the examination. So which one gives a better image? For many gynecological indications and follicular tracking, TVS generally provides more detailed visualization because the probe is much closer to the pelvic organs. But this does not mean that the transabdominal pelvic scan is inferior in every situation. They actually complement each other. Sometimes, the sonographer may start with a transabdominal pelvic scan to get an overall view of the pelvis and then perform a transvaginal scan for a closer and more detailed assessment. Also, in cases of larger fibroid masses or larger pelvic masses, a transabdominal pelvic scan is usually more preferable. So let me answer some of the questions I get about TVS scan. The first one is it painful? This is an important question because many women are scared of having a transvaginal scan, but then TVS should not be severely painful. The probe is covered with a protective sheet and lubricated before insertion, and it is inserted gently and only as far as necessary. However, some women may experience pressure or mild discomfort, particularly if they have pelvic tenderness. And if the examination is painful, you should communicate with your sonographer. TVS is not a painful scan. You may experience mild pressure and discomfort, but not pain. The second question is, can a virgin have a transvaginal scan? A transvaginal scan involves inserting a probe into the vagina, so it may not be appropriate for every woman. Whether it is performed depends on the woman's age, clinical situation, consent, the local practice, and individual circumstance. A transabdominal pelvic scan can be used when TVS is not appropriate or acceptable. Another question I get is, can it cause miscarriage, especially in early pregnancy? No. A transvaginal scan cannot cause a miscarriage. Your baby is safely protected in your womb. far away from where the probe is reaching. So a transvaginal scan cannot cause miscarriage even in very early pregnancy. And one last question: can TVS be done while you are on your period or having heavy bleeding? In some situations, a transvaginal scan can still be performed even when you are bleeding slightly, depending on what the doctor or sonographer is trying to assess. Certain parts of the menstrual cycle may actually be useful for particular examinations. However, very heavy bleeding can sometimes make the examination messier or affect the visualization of certain structures, depending on what is being assessed. And remember, you should always feel comfortable telling the sonographer if you are bleeding heavily or if you're experiencing significant pain or discomfort during the scan. So which one should you have? If you're checking for general pelvic structures, a transabdominal pelvic scan is very sufficient for you in most situations. But if the questions involves very early pregnancy, the endometrium, antral follicular count, small ovarian lesions, or detailed assessment of the uterus and the ovaries, or a follicular tracking, TVS may provide better visualization, and sometimes both approaches are needed. In summary, pelvic ultrasound describes the examination of the pelvic organs, while transvaginal ultrasound is one way of performing that examination. So don't think of two of them as completely unrelated scans. No, they are actually related. Transabdominal pelvic scan is done through the abdomen. Transvaginal scan is through the vagina, closer to the pelvic organs. So now you know. Pelvic scan doesn't necessarily mean transabdominal only. TVS is also a form of pelvic scan. The main difference is the route of examination. One is through the abdomen, the other is through the vagina, and then the proximity of the probe to the pelvic organs. I hope you get the difference now. If you have any more question or confusion or experience you would like to share, feel free to drop it in the comment section. Don't forget to like, share, and subscribe, and follow for more simple ultrasound explanations and women's health education. And I'll see you in my next video.